Hello everyone and welcome back once again. This is your civics teacher here, and this time I am here with a brand new chapter of NCERT grade 7, that is role of the government in health. Students, people in a democratic countries such as India expect the government to work for their welfare, and usually by providing services such as affordable houses, basic education, good health care, productive employment, etc. Students, here this chapter basically discusses health as an important issue for people. And students, there are both public and private aspects of health provisioning. Students, our constitution supports a view that the right to health is an aspect of our fundamental rights, means it is the fundamental right of each and every citizen of India. But though the constitution supports it, still healthcare in India is not available to all. So students, through this chapter, you will begin to visualize the ideal or desired role of government and the meanings behind its structures. And students, in this lesson, we will also look at what governments do for people's welfare, particularly in providing healthcare services to the people. And students, we will also discuss some ways in which the situation of health services can be changed in India. So, let's start. So students, before moving on towards the chapter, the first thing that you must need to know is that what is health, or how can we define health? Students, usually being healthy means being free from diseases. But in the modern world, health also means doing active work and being in good spirits. So we can say that health doesn't mean the ability to free of illness and injuries. In fact, apart from diseases, there are many other factors that affect our health, such as dullness, inactiveness, and anxiety, or being scared for long stretches of time. So, we can say that health is a state of complete physical, mental, and social well-being, and it is not just merely the absence of disease or infirmity. Now students, let's understand that what are the healthcare facilities available in India. Students, you will amazed to know that India is the fourth largest producer of medicines in the world, but India also has one of the largest population in the world, and a lot of resources and planning are needed to provide all the Indians with good healthcare services like health centers, hospitals, laboratories for testing, ambulance services, blood banks, etc. But students, due to this huge population in India, many people even today don't get enough clean drinking water to drink, clean toilets, and neighborhoods to stop the spread of diseases, and even nutritious food also. And students, although many Indians become doctor and nurses, but most of them take up jobs in the cities. So the people in the villages either don't get good healthcare or have to travel long distances to get medical treatments. So students, to provide the basic facilities like ambulance services, laboratory for testing, hospitals, health centers, we need health workers, nurses, qualified doctors, and other health professionals who can advise, diagnose, and treat illnesses. And students, not only this, even we also need medicines and equipments that are necessary for treating patients. Students, as I said that India has a large number of doctors, clinics, and hospitals, But most of these doctors and nurses take up their jobs in the cities. And students, in India, there are many public healthcare system of hospitals and health centers that are basically run by the government, and it is the responsibility of the healthcare system and the health center to look after the health of a large section of Indian population that are basically scattered over hundreds of thousands of villages. But students, as I said, that most of the doctors and nurses take up their jobs in the cities, and so the people in the villages either don't get good health care or have to travel long distances to get medical treatments. That's why even after having public healthcare systems, the government of India not able to provide proper healthcare facilities to people. Students, the healthcare facilities are basically divided into two main categories, and that are public and private healthcare facilities. Students, now let's discuss each healthcare facility in detail. As the first one is public health services. Students, the public healthcare system is a network of clinics and hospitals that are basically run by the government in both rural and urban areas. And students, at the village level in India, there are health centers where there is a nurse and a village health workers. And students, these nurses and health workers are basically trained under the supervision of the doctors at the primary health centers. And students, such a center means PHC, primary health centers, covers many villages in a rural area, whereas at the district level there is a district hospital that supervises all the health centers. And students, in large cities there are many government hospitals and even some specialized government hospitals too. Now students, as I said, that these healthcare systems are called as public system. But students, do you know why they are called so? Because these hospitals and health centers are established by the government for each and every citizen of India. The second reason is that the medical facilities that are provided here in public healthcare centers are at low cost so that the poor can also seek for treatment. Now students, the another important function of public healthcare center is to prevent the spread of diseases like tuberculosis, malaria, jaundice, cholera, diarrhea, chikungunya, etc. And students, it is the responsibility of Indian government to safeguard the right to life of each person. And in fact, according to our constitution also, it is the primary duty of the government to ensure the welfare of the people and provide healthcare facilities to each and every citizen of India. Now students, the second category is private health facilities. Students, as the name suggests, the private healthcare system is not owned by the government, and India has many private healthcare facilities such as clinics, hospitals, laboratories, colleges, etc. that are basically run by individuals. And students, as I said, that these private health facilities are not owned or controlled by the government. So the patients have to pay a lot of money for every service that they use in such healthcare system. Students, here in these private healthcare centers, many doctors practice in their own private clinics, and many also provide specialized treatment. And in fact, there are now many large companies that run networks of hospitals or manufacture and sell medicines on a large scale. Now students, the next topic is healthcare and equality. Means is adequate healthcare available to all. Students, although India is a democracy, but not all Indians get equally good healthcare here. And students, the most common reason for this in India is that private services are increasing fast, but public services are the same. There is no increase in the public service. So, therefore, many people have access to mainly private services. And students, the another reason is because of the population of India that is very huge, and also because most new medical staff and facilities are in the cities, whereas most Indians live in villages. So students, the cost of the private services is very high, and even some private services encourage incorrect practices to earn more and more money from people. So students, therefore, for a middle class family, medical expenses cause hardships, and every illness in such a middle class family cause of great anxiety and distress. And students, further, the expenses on the illness make their situation even worse. Students, as we discussed in our earlier section about the public and the private healthcare centers and what are the facilities that they provided and how both the healthcare centers are different from each other. And we also discussed that how in order to earn more and more money, private healthcare center encourages more and more incorrect expenses. And students, in fact, according to one study, 40% of the patients in Indian hospitals have to borrow money or sell their possessions like cars, properties, houses to pay for their medical expenses. So students, this is a major problem among the middle class families in India. So now let's discuss the solutions that what government has to do in such a situation. Students, as you all know that India is a democratic country, and being a democratic country, it is the responsibility of the government to provide quality healthcare services to all its citizens, especially the poor and the disadvantaged group of the society. And students, secondly, the basic medical facilities should be available to everyone, everywhere, and not just to rich people in the cities. And the government of India and people have to work together to improve the health of the nation. Now students, let's understand this topic clearly with the help of two examples. As the first example is of Kerala. Students, in 1996, the Kerala government allocated 40% of its budget to the rural panchayat and the freedom to plan and provide for the needs in their villages. And students, through this, there was some positive changes as the money was used for the betterment of all the facilities in villages like water, food, women's development and education. And as a result, healthcare centers were also improved. Now, the second example is of Costa Rica. Students, do you know where it is? Students, Costa Rica is considered to be one of the healthiest countries in Central America. And students, many years ago, the Costa Rican government took a very important decision of not having a national army. This meant that all the money which was used to manage the army could be used for more useful projects such as on health, education and other basic needs of the people. And students, the Costa Rican government took this step because it believes that a healthy population is the most important factor in the development of any country. Now students, that's all about your chapter number 2, and with this topic here, your chapter number 2 is completed. Now I will be come back soon with another chapter. Till then, stay home, stay safe and stay healthy.